I met Dr. John Veldheim, an Australian man, in 1993. I was living in Malta at that time, and he was traveling the world basically to teach seminars, which fascinated me and already helped me for my personal life and also my profession. And when he came in 1995 to Malta and had developed in the meantime the BodyTalk system, I just said, yes, I want to learn this too. And I was so fascinated by it that I basically started practicing and teaching quite immediately. John Veldheim is a fascinating character. He's a beautiful person, a philosopher, a visionary. And by profession, he's actually a chiropractor, an osteopath, and he also has studied traditional Chinese medicine. He practiced all of this successfully in his clinic in Australia for many, many years, but he also taught it to students in different colleges there. Apart from the main categories he was working in, he also did lots of trainings in other healthcare fields. However, mostly he was really seeking for a solution for his own healthcare problems and health issues. And so this is how he came about BodyTalk. And he found the solution, he's still working on it and improving the system and developing the system. And that has fascinated me, as I mentioned already, so much that it's so beautiful to be able to pass this on to other people, other patients and practitioners worldwide. With BodyTalk, we have a very complementary and integrative approach. That means it's also helping other modalities to work better. And so there's no contradiction or conflict of interest when working with the patient. The usual approach to healthcare would be to ask the question, what is missing in the person? What is wrong? Where is the problem? Whereas the holistic and specifically the BodyTalk approach is, where can we go from here? What can we, what could our target be? How can we help the self-healing process? So that is very different to the normal, usual approach.
So many people ask me, why should I come to BodyTalk sessions with a certified BodyTalk practitioner? Well, you're asking the wrong person there, because I know from my long years of experience with BodyTalk that BodyTalk just works. It works for myself, it works for my family, my friends, a lot of people whom I have been teaching to, and so forth. So the easiest would be obviously to try it out. It might be confusing to have so many different therapies who all have kind of, it seems, the same message. And what a lot of people also ask me is, have there been any studies that have been done with BodyTalk in the scientific community? Generally, we can say BodyTalk is still part of what we call experiential medicine. However, there have been studies that have been conducted, and they were actually conducted within the lines of the health authorities in the US of A. And so there were great benefits doing BodyTalk, and but still there are very few studies, and we can always say, you know, just try it out for yourself, and like the many thousands of people worldwide, you know, feel, and then you know what BodyTalk is about.
The BodyTalk system is consciousness-based healthcare, or as the philosophers say, consciousness is all there is. When we talk about innate in the BodyTalk system, it basically refers to the consciousness aspect. Innate is something overall, and when we talk about the innate wisdom, it is a localized consciousness referring to the individual patient or client we're working with. And in a BodyTalk session, it is very important to have access to the individual consciousness, the innate wisdom, and also to enable the energy flow between the individual consciousness and the universal consciousness to access the potential of healing and self-healing.
So the BodyTalk system was founded by Dr. John Veldheim in 1995, and for a long time he had thought about how he can approach holistic healthcare so it is really, really accessible for everyone. People who have already been studying therapies and have been working in the therapeutic field, but also for the so-called lay person. And the beauty of the BodyTalk system is that the protocol we use, the procedures we use are very, very structured, so that means the average person can really learn it very, very fast. And immediately go out and practice it at home or in their clinic. And the unique approach of BodyTalk is really that we're taking the whole person into consideration. Now, a lot of people say that, a lot of therapies say we're working holistically, But we have to really look into all the details which a human being has or is part of in their everyday life. So that means our physical body, our energy body, the meridians, the chakras, our environment, which we have an effect on, but also the environment has an effect on us. Our story, our personal history, our childhood experiences, our conditionings, our belief systems which we have been programmed with, that seems to be part of our human life. And what we have observed in BodyTalk, especially in BodyTalk sessions, is that when we're doing these treatments, that basically our human hard disk, as we say it, where all these experiences have been stored and all our blockages are visible really, and the energy is not flowing properly. When we do a BodyTalk session, people change their posture, the way they move, the way they approach life in general. So people are usually more centered. And we feel it is very, very important that a therapist understands that a therapist also takes sessions for him or herself, because only then he can be really there for his patients. And there's so many treatment modalities out there, so many seminars one can learn, and it might be a bit confusing for a lot of people, for you to choose, why should I go to BodyTalk? All I can say is that worldwide, BodyTalk is really taking off right now. It's a state-of-the-art healthcare, and at present there is big plans to incorporate BodyTalk in universities, in the so-called quantum university, and so we're really, really looking forward to this new path for BodyTalk. Over the years, the BodyTalk system has grown quite a lot. So we have the foundational training, BodyTalk Fundamentals, which is a very intense, usually 4-day course. And you should practice that after you've learned that for a while, and then possibly do your exam to become a certified BodyTalk practitioner. And after that, you could decide to maybe do some advanced training on specialized modules and courses. And then there's also further modules and courses which are focusing on specific aspects, for example, of the foundational training, such as body chemistry or the fascia and structural work in the body, but all from an energy approach. So even if you are in a country where you cannot really physically touch the body, you could still use the BodyTalk techniques, and that's very beautiful. And the big vision of Dr. John Weltheim is to eventually have the profession of a BodyTalker in all the countries of the world, and we're very much looking forward to that too. BodyTalk is well known to be a very good therapeutic system for the human being. However, it is also interesting to know that BodyTalk can also be applied to animals and to plants. And we have a lot of practitioners who really specialize in that line. So they can work with domestic animals, they can work with animals in the zoo, or especially in South Africa, we have a lot of practitioners who are actually practicing with the wild animals in the parks. And it's very beautiful to see how the rehabilitation or the general health of the animal is just improving with BodyTalk sessions. And in the plant world, we have quite a few people who have been doing little experiments for themselves or even professionally to see the before and after, how a plant is changing. You see, a lot of people say, do I have to believe in BodyTalk? And I say, no, you don't, because you can see the differences. And obviously you can see the differences much more when you look at animals changing, their behavior changing, their health changing, but also seeing the plant growth change. So you can just try it out for yourself.